So the first part of the program has really set out the global nutrition challenges. And obviously there's a need for global action to tackle malnutrition in all its forms. So we are now turning into part 2 of the program. And here we'll get examples of efforts that is actually being done globally to combat malnutrition. And we're so lucky to have Kaja Engesveen from the World Health Organization to be the first presenter. Welcome.
Thank you very much, Anna-Lena, and thank you very much for inviting us to this important seminar here today. It's a great pleasure for me to be here in Oslo, particularly. I would also like to extend a thanks to Wenche in particular. Without her energy, dedication, and ability to lift students up and forward, I would not have been here today representing the World Health Organization. So WHO has recently developed a 10-year strategy for nutrition, which aligns also with the time frame of the UN Decade of Action for Nutrition. The vision of this nutrition strategy is a world free from all forms of malnutrition, where all people achieve health and well-being. Now, this is an important phrase, as it really describes the work of WHO. We focus on the world and aim to achieve impact in all countries. We focus on all forms of malnutrition: underweight, overweight, and obesity, micronutrient malnutrition, diet-related NCDs. We focus on all people through a life course approach, which includes all population groups. The 1,000 days are particularly important, as was described earlier. And there is also a growing recognition of what is called the subsequent 7,000 days until the end of adolescence, as this is also a period that could present opportunities to help children reach their full developmental potential. And this may also give a further impetus to the children's right to grow and develop. Finally, we focus on health and well-being. In line with the WHO Constitution, the definition of health is a state of a complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So our core functions in the nutrition strategy is leadership, guidance, and monitoring. So through leadership, we stimulate global and national policy agendas and support policy implementation in countries. On guidance, we develop evidence-informed guidelines and related implementation tools for healthy and sustainable diets and for effective interventions to be mainstreamed in the health system. For monitoring, we monitor and set targets at both global and national levels. For example, on the global level, we develop indicators and cutoffs, and we also support countries to establish monitoring systems at national level, which is very important for fostering accountability. WHO conducts policy dialogue in countries. This slide you see here shows an analysis of 660 policy documents in 167 countries, which will soon be published in the second Global Nutrition Policy Review. And it shows the uptake of the global nutrition targets that Liv Elin mentioned. And what we have seen since the first Global Nutrition Policy Review is that there is an increased uptake of the global targets, which is very good. Particularly in the African region, there is an uptake on the global target of child overweight. On the other hand, some other targets are lagging behind, like anemia in women and exclusive breastfeeding, which are really global issues and pertain to all countries. Breastfeeding is not only important to protect against undernutrition, but also overweight and obesity. And the major gaps we see in these two areas are actually in the European region. So please go home and do some homework there. WHO also defines healthy diets based on evidence-informed guidelines for dietary goals. This slide is also from the same review. It shows how countries are implementing actions to promote and protect healthy diets. And what we have seen is that there is an increase in countries implementing regulatory approaches, especially for nutrition labeling. But overall, actions are still more focused on informing consumers rather than changing the food and drink environment, like Nana talked about. It's really important. One important action to actually improve the food and drink environment is to protect right holders from misleading or inappropriate marketing of unhealthy or unnecessary foods and beverages. The World Health Assembly has now adopted guidance across all age groups of children to support countries establishing national regulations. On breast milk substitutes in 1981, on food and non-alcoholic beverages to children in 2010, and on complementary foods in 2016. A core mandate of the WHO is to develop guidance on essential nutrition actions to be scaled up in the health system. This also aligns with the agenda on universal health coverage, which is one of the Sustainable Development Goals. And I need to note here that what you see is just a small selection and what I could possibly fit within this short time frame. In 2016, WHO issued guidelines on antenatal care, not only for nutrition, but across the whole line. But it includes important recommendations on nutrition counseling to pregnant mothers and also other nutrition interventions. Last year, in 2017, we issued guidance for the prevention of overweight and obesity through primary health care as an update to the Integrated Management of Childhood Illnesses, or IMCI, as you must know it as. These recommendations, they guide countries on how to assess, manage, or refer overweight and obesity as necessary. And importantly, they also guide countries on how to prevent overweight while managing undernutrition. So when to use and not to use supplementary foods, for example. I also wanted to highlight the recent updates to the Baby Friendly Hospital Initiative, the BFHI, which recommends the initiative to be integrated and the 10 steps to successful breastfeeding to be integrated into national standards for quality care in hospitals. And for those who want to learn more, many other nutrition interventions exist within the Essential Nutrition Actions and also in the e-library of evidence for nutrition actions, which you can find on the WHO website. Another powerful tool that is very much conducive with the human rights agenda are the WHO Child Growth Standards. The standards, which were developed in 2006, were based on a multi-country study which showed that infants and children from geographically diverse regions of the world, including Norway, had very similar growth patterns when they were given an optimum start in life. And this is important because it really gives the scientific evidence that children have the same potential and right to grow and develop. Malnutrition really reflects a violation of rights at multiple levels. And like Peter mentioned, millions of children suffer from stunting, wasting, or overweight in the world. However, evidence-informed actions exist to address these conditions, and we need to expand the concept of needs of children to needs and rights to appropriate evidence-informed interventions. Some lessons learned before I end. We need to have a comprehensive understanding of malnutrition. Malnutrition in all its forms, it really addresses all countries, communities, and even the same households, and also the same individuals in many cases. It's important to address the underlying and basic causes, like Livelin told us about, and also to ensure a healthy food and drink environment, like Nana talked about, at the same time while we prevent and treat malnutrition through the health system. We also need to bear in mind the importance of the life cycle approach that Peter described, and in particular the intergenerational impacts. In order to mainstream nutrition in health systems, we need to be part of the planning that they are doing in that sector and make sure that nutrition is included in the health sector strategy costing tools, as well as in key protocols for antenatal care or the management of childhood illnesses. We need to be better at integrating nutrition into relevant policies to avoid siloed approaches. In the second Global Nutrition Policy Review, for example, we observed that only 1/5 of NCD policies had policy goals on exclusive breastfeeding. And this means that those problems are tackled separately. WHO, of course, is a normative agency in most cases, especially in nutrition. And we therefore need to work with partners to achieve that nutrition guidelines are implemented and scaled up. Finally, having a policy or regulation is not enough. There has to be a robust and continuing monitoring and enforcement towards, which are important steps towards accountability. And for this exercise, to ensure robust and continuing monitoring, it could be a possibility to also include national human rights institutions for them to use their mandates to monitor violations of the children's right to health, to safe and nutritious foods, and to add appropriate information and protection from inappropriate information in relation to nutrition guidelines. Thank you very much.
Thank you, Kaja, for describing the comprehensive role of the WHO. So the next speaker is Louise Meinke from World Cancer Research Fund. Welcome.
Just checking. All right, thank you. Hej alle sammen. Jeg er dansker, men vi snakker på engelsk i dag, so here goes. My name is Louise Meinke. I'm the head of policy and public affairs for World Cancer Research Fund International in London. And World Cancer Research Fund International is a leading organization on the scientific analysis of the link between the prevention of cancer and diet, weight, and physical activity. And what we have found through this scientific analysis is that 11 common cancers basically, you, as an individual, you are at increased risk of 11 common cancers if you are overweight and obese. And as Nana said earlier in her presentation, we also know that when you're overweight or obese in childhood, that this can easily track into adulthood. So there's a real role and responsibility from our perspective of governments to develop and implement effective policies that create healthy environments for individuals to live healthy lifestyles. Now, as an organization, we have all this scientific evidence, which is fantastic, but how do we actually translate that into policies for governments? So what is it specifically that we're asking governments to do? You know, we often have this conversation with governments, and the question is, well, what do you want us to do? There is so much, and there is a lot of information out there, and it's quite hard to synthesize all this information and know where to start. So this is where World Cancer Research Fund International developed the Nourishing Framework and Policy Database. So I'll speak a little bit about our framework and our database today to give a little bit of an insight and hopefully some food for thought around how the database can be used by organizations and people that are in the human rights space. So Nourishing is a framework which outlines a comprehensive package of policies for governments. And the idea is that we want governments to take actions in each of these policy areas in order to promote healthy diets and reduce overweight and obesity, and therefore diet-related NCDs as well, including cancer. Now, what is unique about Nourishing is that it has 3 domains. Let me see if I can actually get this to work. So basically what we have is 3 key domains. We have the blue one, which is the food environment, the green one, which is the food system, and the orange one, which we called individual behavior change. And each of the 10 key policy areas of Nourishing is within these 3 key domains, or the 10 policy areas is within each of these 3 key domains. Each of the letters in Nourishing, as you can see, relates to a policy area. So in the interest of time, I'm not going to go through all of them, but I will just highlight the framework itself. Now, what is good about this framework is that it is applicable globally, but it also enables governments to look at it and go, well, what is actually most relevant to our local and national contexts? It is a system for categorizing policy actions. It's a system for monitoring what governments are doing, and essentially then also to hold governments to account for what they're doing well, what they should be doing more of, and perhaps where they're not doing anything at all. So most of you probably have heard about the Ending Childhood Obesity Commission that put out a report, and Nourishing does touch on several of the key recommendations from this report. What I'm going to be focusing on today, in the interest of time, is this space here, the R, which stands for Restrict Food Advertising and Other Forms of Commercial Promotion. This is a key element in the whole fight against childhood overweight and obesity. So I'll go into a little bit more about that. So accompanying the framework, it's not enough just to sort of say, here's a nice framework, this is what we'd like you to do. So accompanying the framework, we've developed a policy database. So the policy database is very, very comprehensive. Now, let's see. It currently has 450 implemented government policy actions from around 129 countries around the world, and it also holds over 90 impact and process evaluations. This is key, so we're trying to work out, even if we're not actually undertaking the analysis ourselves, we are pulling together independent research that shows, has these policies actually worked in practice? What are the outcomes and the intended or unintended effects by them? So the database, as you can see if I can, oh, no, I pressed the wrong button. Oh, can I go back? God, trigger happy. Okay, so can I actually get this done? Okay, so basically when you open up the database, as you can see, you've got all the 10 key policy areas here with all the information. If you then press on R, it will open up a new page. This is a free online resource, I should say. So when you open up R, you will then have the breakdown of example of policy actions, so subcategories of marketing restrictions that governments around the world have implemented. There we go. Again, if you then go into one of the subcategories, you will get more information. And the type of information that you will get in each of these sub-policy areas are specifically a policy description, so much more detail about the actual policy itself. You will get information about evaluations if they are available, because what we find is that if there are 450 implemented policy actions from around the world, but so far we've found over 90 evaluations. Again, you can see the disconnect between the two, so we need a lot more process and impact evaluations done. And then also specifically which country, whoops, a little tap down there, which country actually has implemented the policy. Now, what I'm going to do now is just pull out the information within the R about which countries have actually done what. And I think you will find this quite interesting because it outlines specifically here, this slide here. So out of the 7 subcategories that we have, you can see on this slide the different countries and the year in which they have implemented actions specific to do with the different areas. On this slide, you can see that it's actually that there is most interest in regulating broadcast media. Okay, so in essence, this is problematic because of where we are now, right? So media's developed and advertising are in many more different spaces, digitally, on smartphones. You can also get exposed to marketing at sports events, front of pack, characters. You know, there are so many different ways that children can be affected and influenced by marketing. So we see here that governments prefer to regulate broadcast marketing, probably because it's a little bit simpler in essence, and it hasn't really developed much further. On this next slide, again, a continuation of the different subcategories that we have in the database, you can see again here that I've highlighted Norway. So Norway is actually quite ahead of its game. It's 1 out of 2 countries, Sweden being the other one. So all the way back in 1992, Norway actually, sorry, Norwegians, I meant Norway. So Norway has actually implemented mandatory regulation of all broadcast advertising to children. And what Norway has also done is since 2013, they have started engaging with industry themselves to self-regulate, to restrict further food marketing to children. I'm hoping that another speaker here will go into a little bit more detail about these specific policies. But as you can see, Norway in this particular space, being that they actually implemented this in 1992 and are further developing it, are making progress in some respects on this particular area. So to summarize, because I'm running out of time, I believe that Nourishing is a free online tool which can be used by not just the nutrition and health and diet people. It can also be used by the human rights organizations and individuals. And so far, probably we haven't really reached out to a lot of you, which is why I find it exciting to be here today. Because I would like for it to be used as a much more of an accountability tool, as an instrument for change in actual national context. And if any of you are interested, I will just make a little plug. So my organization is launching its third expert report on the latest scientific analysis of the link between cancer prevention and diet, weight, and physical activity. The report will be launched on the 24th of May, and you can now online request summaries of this report if that is of interest. I will also mention that even though Nourishing is just on nutrition and diet, we have recently received a significant EU grant to develop an equivalent framework and database around physical activity, which also allows us to start the process of developing indicators and benchmarking more specifically for countries around the world about what they are actually doing. Again, to help other individuals to use it as a tool for accountability, right? So that you can hold governments to account. And then finally, just a few observations here. You can see that there is very little activity worldwide in recent years on restrictions. The definition of the child is generally up to age 13, max up to 13 and 14 years. The definition of child-directed marketing, again, generally it says between 20 to 50% of audiences of children or children's programs only. Definition of food and beverages are pulled from different nutrient profile categories of food, maximum limits of salt, fat, sugar, calories, etc. Again, as I've mentioned, mostly regulation of broadcast media and barely any regulation of newer marketing channels, in particular digital media. And there's the whole issue, which I think Amandine is very good on, is the whole cross-border marketing and stuff, those sort of more legal issues that I'm going to hand over to Amandine to talk a little bit more about. And enforcement is often very, very problematic. So on that notice and on this, I will say thank you very much. And this is a picture of all of you being so excited and happy about the information I've just given you. So thank you very much.
Thank you, Louise, for describing for us this very interesting framework for checking what national governments are actually doing, and also for highlighting Norwegian efforts. So that gives us a nice opportunity to introduce Henriette Øyen from the Norwegian Directorate of Health.
Thank you very much. Yes, I will talk about some experiences we have done in Norway to improve the diets in the population. This picture, you see, saw a similar picture this morning. This is from the Global Burden of Disease project, and it's from Norway, and the 10 most common risk factors. And you see that the dietary risk factor is the second most common risk factor after tobacco. And in Norway, we have adopted the global WHO targets to reduce premature death mortality from the non-communicable diseases by 25% within 2025. And how are we going to reach that? We have these Norwegian dietary guidelines, which consist of 12 recommendations. I'm not going very detailed through all these, but Summarized, it's enjoy a varied diet with lots of vegetables, fruit and berries, whole grain foods and fish, and limited amounts of processed meat, red meat, salt, and sugar. So, is it possible to increase the proportion of the population that eats according to the dietary guidelines? To accomplish this, the government launched last year ago, a action plan for a healthier diet with several quantitative targets and indicators within 2021. And the plan consists of more than 40 different actions and was signed by 8 departments. So it has a wide political attention and priority. The main goal for this action plan is that a higher proportion of the population has a diet consistent with the dietary guidelines. And here you see some of the quantitative targets that we are going to reach within 2021. We want to increase the consumption of whole grain products, fruit and vegetables, and fish and seafood by 20% within 2021. And then, on the other hand, it's a goal to reduce the salt intake by 22% and the saturated fat by 12 to 12% of the energy intake, and to reduce the content of added sugar to 11% of the energy. And they are also the goal on the breastfeeding to 60% of are exclusively breastfed at 4 months and 25 up to 6 months. And then also 50% are breastfed at 12 months of age. And the action plan involves 5 priority areas. It's about the meal enjoyment and a tasty and healthier diet. It's about healthy choices, healthy and easy choices, communication and knowledge, food, meals and nutrition in health and care services, and research, development and innovation. And to succeed on all these areas, both public authorities, private actors and organizations must work together. And since I just have a few minutes, I cannot go through all of these priority areas, but I will concentrate on healthy and easy choices and communication and knowledge. Our health minister has established a food industry group to address the industry's responsibilities to improve public health. And the group consists of industry leaders from the major companies in Norway's food production and retail sectors. And the first topic was initiated in 2014, and the topic was salt, and the health minister launched a salt action plan, where the aim was to reduce the salt intake by 15% by 2018, this year, and 30% by 2025. And in 2015, the Norwegian Directorate of Health and enterprises in food industry, hotel, restaurant, catering industry, trade organization, research and interest groups signed a cooperation agreement concerning the SALT partnership, which now consists of 77 partners. And then in December 2016, this food industry group members signed a partnership for improving the Norwegian diet. And all the common goals are based on the officially dietary guidelines. And the purpose is an overall collaboration between the food industry and health authorities, and to make it easier for consumers to make healthier choices. And this is the common goals of the partnership. It's what you want to obtain is reduced added sugar by at least 12.5% reduction by 2021, reduced fat, saturated fat from 14 to 13% of the energy within 2018, and reduced salt from 10 to 8 grams per day within 2021. And then we want them to increase more fruit, vegetables, and whole grain products by 20% within 2021, like also is the same goal as in the action plan. And in this partnership, the companies, they can choose their own measures and action on how to achieve these common goals. It could be by reformulation of food products, can be portion sizes, how and where they place the food products in the stores, and so on. So this is in what we say in the opposite of regular government control with taxes, regulation, and standards. And to succeed in this partnership, it is really important to have good systems for monitoring progress and evaluating the work. And the Norwegian government, the Norwegian Directorate of Health, is responsible for monitoring and communications. So a few words about that. So this is the front pages from some Norwegian newspapers over the last years. Diet is extremely popular and a noisy topic in the media. And the media also, they embrace diet gurus and experts, and who criticize the guidelines from the health authorities, and who often also carry out some quite controversial health messages. And this contributes to uncertainty among the consumers concerning both content and validity of our recommendations. So the communication on food, diet, and health aimed towards the public should be clear, consistent, and easily understood. And that is what we try to achieve by our communication. One of our communication campaign is what we call small change, big differences. This launched some years ago to regain the population's deep confidence and increase the knowledge and the dietary guidelines. And we want to have a stronger visibility in the debate on nutrition, while at the same time having a better dialogue with the population on the topic. So this campaign promotes the idea that just small adjustment in everyday life can make a big difference in health in the long term. And the campaign also aimed to increase knowledge and confidence in the dietary recommendations, while at the same time showing how they easily can be translated into everyday habits. And here we communicate through different channels and, of course, social media. This picture is from some of our campaign the latest year. We see this keyhole label in the middle, which is a label that tells us that this food product contains less sugar, salt, and saturated fat, and more fiber than the product in another product in the same category. So we have yearly campaigns to promote this label and to encourage people to buy products with this label on. And on the right side, we have from 2 years ago a salt campaign to tell people that what's the consequence of eating too much salt. And it says on the top there, some decades ago, we were exposed to greater danger without understanding it, and we still do. And then it's a salt shaker there and tells us it's different. Now it's dangerous to eat too much salt. But of course, we want to increase knowledge, but both tell the people that we get too much salt or sugar or is it saturated fat, and what are the sources in the food that we eat, and what are the health consequences. But also we want to help the population, and how can they, we can help them to how to reduce the intake of salt, sugar, and saturated fat, and how can we help them to increase what we should eat more of. So giving them helping hand. And we also use quite a lot of humor. Maybe some of you have seen this on the left side, the sugar kind of campaign we had last year. But then finally, now we have this spring, we're going to launch a campaign, and we are going then to focus on what we're going to eat more of. Vegetables, fruit, berries, fish, seafood, and whole grain products. So this campaign will be launched this May or June then. So this is also to support the intention agreement between the health authorities and the food industry. And we will also collaborate with the Food Safety Authority, Immigrant Organization, and Preventive Health Services. And the target group is parents and children in the age of 9 to 13 years old. So this was just a little about how we're working in Norway. Thank you very much.